This is Steve Adubato. Thank you so much for joining us remotely. We want to kick off this program with a very compelling and important conversation with Dr. Perry Halkitis, who is Dean of the Rutgers School of Public Health. Doctor, good to see you.
Good to see you too.
Okay, sports, schools, COVID, let's put it together. Reading a piece that you wrote called High School Football Tip. You can't wear PPE while playing left tackle. Make the case that football makes no sense.
Look, I would be the first of all, thank you for having me here. I would be the first person to say that I love sports. I want sports. I'm so upset I'm not going to the US Open this year. You have no idea. However, I think that in a society that's trying to function, that's trying to get back to some sense of normality, there needs to be some concerted effort to open the institutions that are the most critical. And in my mind, as we think through the next few months, those are schools, those are places where we can vote, and those are businesses where people's livelihood actually depends on having clientele. What you get when you contain the virus and you're able to not have people die at the rates that they're dying is then you get to have football and concerts and big weddings and all those wonderful things we're used to having that would happen in a normal time. But this is not the time for that. And I will come back to the comment I made about football, which is it is a contact sport. I worry about the infection being passed from the player to player. More importantly, I'm worried about the infection then getting back to the families of those players where there are vulnerable people who may die of the disease.
We're going to talk offline because our 16-year-old Nick, who works with us on this production, he and others are saying, wait a minute, why is it okay for baseball? And again, we're doing this at the end of the end of the summer 2020. We don't know what's going to be happening. Why is baseball okay, at least for now? What about basketball in the bubble? We're going to talk offline about that or do another conversation. But I'm going to go back to the question of testing, contact tracing, and why it's simply not working as well as it should be.
Yeah, so great question. So first of all, how I wish we had a national strategy that told us what to do.
Excuse me, the president, I'm sorry for interrupting. President Trump said, it's not on me. It is on the states and the governors.
Right.
Correct?
Right, he did. And what we saw in countries that had a national strategy was that the virus was contained. So let me do my Greek pride story for a second, right? You know, my parents are immigrants from Greece. Country is in economic turmoil for what, 12 years? They've contained that virus. You know why they've contained that virus? Because everybody made a decision that they were part of a civil society that takes care of other human beings, right? And so they stayed in their homes, they had to text to leave, and they contained the disease. You have to take severe measures. Now, let me get to your question about testing and contact tracing. It's not working as perfectly as we would want it to work because we're muddling through all of it. We have 51 different responses in the United States, right? And in some states, the tests are available. In other states, the tests are not available. Let me, as an example of why I think it's really not working, is my own personal story. So I'm a scientist and I make myself a subject sometimes. So about 3 weeks ago, I went to a local clinic here in Newark, which is my hometown, and I had a PCR test, a viral test, and I indicated at the time I had no symptoms, right? Which we know 40 to 50% of people do not.
Asymptomatic.
Asymptomatic. 16 days later, I got the results. So testing's not working in some ways. How, therefore, will contact tracing work? Imagine if I was negative, and I knew I was going to be negative because I have antibodies. How would contact tracing work if I had been floating around for 16 days in my community, spreading the disease to people? So this is the problem we have right now. In some ways, the testing in some places in the United States is as bad as it was in March. And so that's that. And the contact tracing, you know, in our state, in the state of New Jersey, I mean, I think we're fortunate right now. We have enough bodies that are out at the local health departments. You know, the Department of Health is working 24/7 to ramp this up. But what good is getting a test result that's 16 days old?
Is it virtually no? We were 14 days until I, in fact, had the Rutgers, dare I say, the saliva test at one of the local government offices, and I think it was 3 days. Reasonable. 16 days, useless. 14 days, useless.
Right. But think about this for a second, Steve. The saliva test, which is the one that's turning around absolutely quickly, right? Everybody doesn't have access to that right now.
That's
right. We need to give everybody access to that test. 3 days, fine. Because then you say, here's my case. I'm going to contact that person within 24 hours. I'm going to get the names of the contacts, and then contact tracing is really going to work.
Question. You understand the human, you love sports, you love tennis. I do. By the way, I play golf when I can. In my mind, I think it's safer than football, basketball. Am I right? Or
Correct.
Am I just telling myself
Correct.
what I want to think?
No, it's I do addictions research also. It's called harm reduction, right? So which is less harmful, right? So ultimately, tennis, golf, you don't need to be tackling anybody.
Nope.
You don't need to be touching anybody.
No.
Basketball, soccer, or as we like to call it, what the rest of the world calls football. Football, you touch people. So yes, it is about harm reduction.
When it comes to schools, I need to do this. As we do this program, literally a couple of days after the governor, people say changed his point of view. I don't know if he changed it, but Governor Murphy said, you can go online, you can have your schools online if you cannot meet certain criteria to keep kids, students and faculty, staff safe. The right decision?
Yeah, so I have what I refer to as the Perry Halkitis plan for schools, which I'll share with you, which I actually think is a different plan. Look, I get the pressure to get the kids back to schools. I totally understand social and emotional development, absolutely. Here's what I think needs to happen. The high school kids, remote. Maybe even the junior high school kids, right? They stay home, they do remote, they're basically adults, they're almost adults. They don't really want to go to school anyway. They can do their work. They can do their work from home. Then you use the high school buildings, right, and the junior high school buildings for the K through 5 kids, and you spread them out all along those multiple buildings. That way, those children who I think need the most social interaction with teachers, the most social interaction with other kids, would be in a physical space.
What about keeping teachers safe and faculty and staff?
It will keep them safe if we can spread the kids out. If we can take the 25 kids in a classroom, right, and say 8 are going to go to this building, 8 are going to go to that building, 8 is that would be ideal. But you're right. I said this actually the other day at some event that I was doing. I was like, we are expecting a 5-year-old to socially distance, to physically distance, and wear a mask all the time. And the 5-year-old in the White House doesn't do that. So why do we expect the 5-year-old who's in our schools to do that?
I hate to end on that note, but we're out of time and people can decide for themselves what to do with it. Dr. Perry Halkitis is Dean of the Rutgers School of Public Health. Also, I want to make it clear that as we speak, you are in fact, are you co-chairs with Micheline Davis of the Public Health Committee on the Newark reopening, right?
Yeah, I work with my friend Micheline Davis on doing the testing and tracing elements for our wonderful city of Newark. Yes.
Terrific. Hey, listen, Perry, thank you so much for joining us. It will not be the last time. All the best.
My pleasure. Thank you.
I'm Steve Adubato. Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by RWJ Barnabas Health, the Robert Wood Johnson Foundation, PSE&G, the New Jersey Economic Development Authority, the Healthcare Foundation of New Jersey, New Jersey Board of Public Utilities Clean Energy Program, Johnson & Johnson, the Port Authority of New York and New Jersey, and by Valley Bank. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Monthly.
In the fabric of America, they are the toughest threads. One of the first things they learned was the code that every service member lives by: leave no one behind. Now all of us need to live by it too, because some veterans are being left behind. 20 of them take their own lives every day. Learn how to be there for a veteran at BeThereForVeterans.com. Honor the code. Be there. Leave no one behind.